The accurate diagnosis of hearing loss has long been beset by problems. Many of these would be resolved if it were possible to measure simply and accurately the sound transmitting characteristics of the middle ear mechanism. What is going on behind the tympanic membrane? Is there a pathological lesion or a language barrier? Serous otitis to be resolved? Or is there a lesion of the nerve? Many of these questions can now be answered by use of the MADSEN electroacoustic impedance bridge, which, for the first time, enables rapid and accurate estimations of acoustic impedance to be made in clinical situations. This machine produces results so quickly that the patient's main complaint is that he no longer has time to appreciate fully the finer points of the examination. But what is acoustic impedance, and how can it be measured? In the normal ear, sound waves are conducted along the external auditory canal to the tympanic membrane. Most of the sound energy is absorbed by the membrane, setting it into motion along with the ossicular chain and thereby transmitting it to the cochlea. However, not all of the sound is absorbed by the drumhead. Some of it remains in the external canal. The normal ear absorbs much sound and is said to have a high compliance to sound, or a low acoustic impedance. Conversely, an ear which absorbs little sound has a high acoustic impedance and a low compliance. It is possible to quantitate the acoustic impedance of the middle ear by measuring the sound pressure level of this residual sound in the external canal. The ear canal is plugged and a sound source introduced. It delivers sound of known intensity. A probe microphone is then introduced to measure the residual sound pressure level within the sealed external canal. If the level is high, it indicates poor absorption by the tympanic membrane. If low, good absorption. Thirdly, the addition of a pump allows the air pressure in the external canal to be varied from that of the middle ear, thus clamping the tympanic membrane. Less sound will then be absorbed by the conducting mechanism, raising the acoustic impedance of the middle ear. One of the essential practical features of the equipment is the probe, which fits into the external canal with an airtight seal. It has 3 holes, to which are fitted rubber tubes connected to the sound source, the probe microphone, and the air pump. A variety of rubber tips are available for the ear probe to ensure a comfortable, airtight seal. After selecting a tip of appropriate size and ensuring that the ear canal is free of debris or wax, the pinner is pulled upwards and backwards and the probe gently fitted into the ear. It may be necessary to try an alternative size of rubber tip. The impedance bridge itself has only 3 simple controls, plus the on-off switch. The first operates a small pump to alter the pressure in the external canal from minus 400 millimeters of water to plus 400 millimeters of water, a range which is small enough to avoid discomfort. The second control varies the sensitivity range of the balancing mechanism. The third balances the sound pressure in the external canal against a constant source in the machine. The knob is rotated until the meter needle is centered, when the compliance can be read directly off the scale, which is calibrated both in acoustic ohms and equivalent cc's. It is usual to attach the bridge to a small audiometer, and for the purposes of this demonstration, we are also showing it connected to a chart recorder and an oscilloscope, although neither are necessary in routine clinical practice. First, the middle ear pressure is measured. The air pressure in the external canal is raised so that the membrane is clamped and the impedance is increased. As the pressure is lowered, more sound is absorbed by the middle ear and the system becomes increasingly compliant. When the pressure in the middle ear and external canal are identical, the maximum amount of sound is absorbed. Lowering the canal pressure below that of the middle ear makes the system less compliant again. This can be demonstrated most graphically on the oscilloscope, set up here as an XY recorder.